I have trimmed down this section from previous versions of MedEd America's online medication administration training. I have, however, left the extended version of all of the classifications of the medications on MedEd America's YouTube channel if you would like to know more about them. The videos provide an in-depth look at various medications you may see when caring for people with disabilities. Psychotropic drugs are usually used in conjunction with other treatments such as psychotherapy. These drugs are generally prescribed for sleep disorders or various psychogenic disorders. This group includes hypnotics and sedatives, anxiolytics, antidepressants, and mood disorder drugs, anti-psychotic drugs, and central nervous system stimulants. It is very important that people are monitored for adverse reactions, drug levels, evidence of noncompliance, dependence, and withdrawal. Sedatives, hypnotics, and anxiolytics have drug classifications and uses that overlap. Anxiolytics, or anti-anxiety drugs, are among the most commonly prescribed drugs in the United States. They are generally used to treat anxiety disorders. The three main classes are benzodiazepines, barbiturates, and buspirone. Sedatives are used to reduce activity or excitement, thereby calming the client. Drowsiness commonly occurs with the use of a sedative. When they are given large doses of sedatives, sedatives are considered hypnotics. Hypnotics induce a state that resembles natural sleep. Drugs from several classes are used as sedatives and hypnotics. They include benzodiazepines, barbiturates, and non-benzodiazepine non-barbiturates. As I mentioned earlier, anti-anxiety drugs are among the most commonly prescribed medications. Buspirone's structure and mechanism of action is different from other anxiolytics. It has several advantages over those drugs, including less sedation and no increase in central nervous system depression when taken with alcohol, a sedative, or a hypnotic. There is also less potential for abuse. If the person you're taking care of is taking MAO inhibitors, it is very important to monitor for high blood pressure reactions. Be sure the doctors are aware that the person is taking buspirone. There are medications such as erythromycin that can increase buspirone's levels. This will require a reduction in the doses of the buspirone while both medications are being taken. Another concern is that it also may increase the level of haloperidol. The most common reactions to buspirone include dizziness, lightheadedness, insomnia, fast heart rate, palpitations, which feel like the heart is flipping in your chest, and headache. If the doctor is switching from long-term benzodiazepine to buspirone therapy, the medication should be tapered off the benzodiazepines to avoid withdrawal symptoms. Antidepressants and mood disorder drugs are used to treat affective disorders, which are disturbances in mood characterized by depression or elation. Drugs included in this category are selective serotonin reuptake inhibitors, also known as SSRIs, tricyclic antidepressants, MAO inhibitors, other antidepressants, and the mood disorder drug Lithium. Anti-psychotic drugs are generally used to control psychotic symptoms, such as delusions, hallucinations, and thought disorders that may arise from schizophrenia, mania, and other psychoses. This group of medications are also called major tranquilizers because they can calm an agitated person, and they are called neuroleptics because they may have adverse neurobiological effects, such as apathy or limited emotions. They fall into two major classes, conventional and novel antipsychotics. Antipsychotics are the first-line treatment for psychoses. They have several other uses that include, but are not limited to, treating organic psychiatric disorders such as dementia, delirium, and stimulant-induced psychoses, sedation for agitated patients, Tourette syndrome, and Huntington's chorea. Remember, take as prescribed. Take the full dose at bedtime if daytime sedation occurs. May take several weeks for full therapeutic effect. Watch for and report unusual effects, especially involuntary movements. Avoid alcohol. Don't take over-the-counter or herbs without a prescriber's approval. Avoid activities which require concentration or coordination until full effects of the medication are known. Avoid excessive exposure to sunlight, heat lamps, or tanning beds. Avoid exposure to extreme heat or cold. Phenothiazines may cause pink or brown discoloration of the urine. There are miscellaneous drugs that are used to treat depression. Trazodone may be useful in treating aggressive behavior and panic disorder. Remember, this group of medication can cause central nervous system depression and may have an additive effect when taken with other central nervous system depressants. Avoid activities that require concentration or coordination until the full effects are known. Take dosage at bedtime if sedation becomes a problem. Take a meal or snack to enhance absorption and decrease dizziness. Notify the prescriber if the person becomes pregnant or plans to become pregnant. Lithium is used to prevent or treat mania and bipolar disorder, which is a mood disorder where depression alternates with mania. Adverse reactions to lithium may occur in any phase of therapy and are usually dose-related. GI effects are most common when the therapy begins and when the dose is increased. Approximately 1/2 of the people taking lithium will experience a fine tremor that may diminish with dose reduction and worsen with dose increase. Excessive thirst and urination, weight gain, hair loss, and skin eruptions may also be symptoms that occur. Remember to take with plenty of water and after meals. There is a narrow therapeutic margin of safety. Be sure blood tests to monitor levels are collected. Watch for signs of toxicity. Don't stop the drug abruptly. Expect transient nausea, frequent urination, thirst and discomfort for the first few days of therapy. Avoid activities that require concentration or coordination until drug's full effect are known. Don't switch brands. Take other prescription medication, over-the-counter, herbal, without the prescriber's approval. People with diabetes should monitor blood sugar carefully. Wear or carry medical identification. Give with food to decrease GI distress. When the lithium level exceeds 1.5 milliequivalents per liter, toxicity may occur. For this reason, lithium levels should be routinely monitored through blood testing. Signs and symptoms of lithium toxicity include confusion, lethargy, slurred speech, hyperreflexia, which is a condition where deep tendon reflexes are exaggerated, and seizures. Long-term use can cause kidney damage. Central nervous system stimulants are often used to treat narcolepsy, obesity, and ADHD. They include amphetamine, atomoxetine, dextroamphetamine, methylphenidate, and pamelaine. Except for the atomoxetine, all of the listed drugs are controlled substances. When central nervous system stimulants are taken with an MAO inhibitor, hypertensive crisis may occur. Another concern is that CNS stimulants may also increase an SSRI's effects. There are a few things that are important to remember. Do not chew or crush sustained-release or long-acting tablets. They may cause dizziness, nervousness, restlessness, insomnia, and GI distress. Let the prescriber know if the adverse effects become bothersome. Use caution when doing activities that require focus or coordination until the full effects are known. Avoid caffeine, and avoid insomnia by not taking the drug late in the evening. Many of the central nervous system adverse reactions result from overstimulation, such as restlessness, dizziness, insomnia, and headache. However, adverse reactions are not only limited to the central nervous system. Cardiovascular reactions, including palpitations, fast heart rate, and increased blood pressure, an enlarged heart may occur with long-term amphetamine use. Most of the medications in this classification are controlled substances, and there is a risk of abuse and dependence associated with their use. The client should be monitored for signs of drug dependence or abuse. Also, the person's blood pressure and pulse should be checked by a healthcare provider periodically. Adverse reactions to watch for include general adverse reactions will be increased blood pressure, palpitations, fast heart rate, and overstimulation. For amphetamines, anorexia, which means not wanting to eat, weight loss, cardiomyopathy, constipation, diarrhea, dry mouth, unpleasant taste. Methylphenidate, abdominal pain, anorexia, weight loss, nausea. Pamelaine, many of the same reactions as amphetamines and methylphenidate, liver failure, hepatitis, and the risk of abuse and dependence. Dementia and Alzheimer's. Dementia is a pattern of mental decline that may be caused by different diseases or conditions. Alzheimer's disease causes over 60% of the cases of dementia, with vascular disease, such as a stroke, being the second most common cause. Common medications used to treat dementia include acetylcholinesterase inhibitors, such as donepezil, Aricept, galantamine, Razidine, and rivastigmine, Exelon. May be prescribed for mild to moderate Alzheimer's. Memantine, Namenda, is approved for the treatment of moderately severe Alzheimer's dementia. Remember, there are also other conditions that you may see where the previously mentioned medications are prescribed. Problems with the respiratory system may range from serious, such as severe asthma and chronic obstructive pulmonary disease, also known as COPD, to the less serious, such as a mild cough and congestion. There are many medications that may be used to treat respiratory problems. Common medications you may see are bronchodilators, such as albuterol and Atrovent, oral corticosteroids, such as prednisone, inhaled corticosteroids, such as Qvar, Pulmicort, and Asmacort, combination drugs, such as Advair, which is both a bronchodilator and a corticosteroid, leukotriene modifiers, such as Singulair, and antihistamines, such as Zyrtec, that help with the allergic reaction component of asthma. Short-acting bronchodilators, such as albuterol, are used to treat the signs and symptoms of asthma or COPD and are often prescribed as PRN, multi-dose inhalers, often known as puffers. Many people refer to them as rescue inhalers since they give rapid relief to symptoms. Albuterol and other short-acting bronchodilators may be used as an inhaler or with a nebulizer to treat chronic symptoms of COPD and asthma. You will see them prescribed on a schedule. Ceravent is an example of a long-acting bronchodilator that may be prescribed to prevent flare-ups of symptoms. Generally, bronchodilators are inhaled because they will exert their effects locally by acting on smooth muscles of the bronchial tree. When you are taking a bronchodilator and an inhaled corticosteroid at the same time, be sure to use the bronchodilator first, wait 5 minutes, then take the corticosteroid. Remember, take the medication exactly as directed, even if you're feeling better. Albuterol should be taken for acute attacks unless directed to do otherwise by a doctor. If 2 puffs are ordered for an inhaler, wait at least a minute between the puffs. If an inhaled corticosteroid, wait 5 minutes after using inhaled bronchodilator to allow airways to open as much as possible. If the medication is not providing sufficient relief, notify your doctor. Corticosteroids are an anti-inflammatory drug that may be used in either an inhaled, oral, or injected form. It is used to control both long-term and short-term symptoms of asthma and COPD. Inhaled corticosteroids usually don't cause interactions. However, oral or injected forms may interact with various drugs. It is important to remember to take the medication exactly as prescribed. Many times the client's oral steroids will be weaned when they are stopped. They may increase the risk of infection. Have the client rinse his mouth after using inhaled corticosteroids to decrease the risk of thrush. Monitor blood glucose closely in diabetics. Monitor for signs of respiratory distress. And remember, barbiturates, dilantin, and cholestyramine may decrease the effectiveness of corticosteroids. Pain medications are also known as analgesics. This group includes narcotics, non-opioid pain medications, fever reducers, and non-steroidal anti-inflammatory drugs also known as NSAIDs. First, we will look at narcotics. Remember, medications in this group are controlled substances. Narcotics are also known as opioid analgesics and can include opium derivatives and synthetic drugs with similar properties. They are generally used to relieve pain, but some may be used to control coughing or control diarrhea. Common medications you may see are codeine, fentanyl, Lortab, Demerol, methadone, Percocet, and Darvocet. It is very important to take the medication exactly as prescribed. Avoid taking with alcohol or other central nervous system depressants. Be careful when getting up from the bed and walking. Avoid hazardous activities until full effects of the drugs are known. Increase fluids and fiber in the diet to reduce the risk of constipation. Watch for signs of respiratory or central nervous system depression. Watch for signs of dependency. Tylenol is found in many pain, cold, and flu remedies. Remember to read your narcotic drug information resource carefully. Many pain medications include Tylenol. For instance, Lortab, Percocet, and Darvocet. It is very important to be sure to double-check for Tylenol in prescribed pain medications and over-the-counter remedies before administering Tylenol to your client. Many Tylenol overdoses have occurred because people did not check and there was additional Tylenol in another drug. Remember, be sure you don't take more than the recommended dosage. Many OTC medications contain Tylenol. High doses or unsupervised long-term use can cause liver damage. Excessive alcohol can increase the risk of liver damage. Be sure to contact your doctor if you need to use the medication for more than 5 days for children or 10 days for adults. Don't use for a fever over 103.1 or recurrent fever without consulting your doctor. Thyroid and antithyroid drugs are used to correct either a thyroid excess, hyperthyroidism, or a thyroid hormone deficiency, hypothyroidism. Thyroid drugs may either be synthetic or natural and may contain T3, T4, or both. Thyroid hormones affect protein and carbohydrate metabolism, stimulate protein synthesis, promote the body's generation of glucose, and increase the use of glycogen stores. Levothyroxine, Synthroid, is the drug commonly prescribed to people with hypothyroidism. Use this medication with care in older people with heart and vascular problems. Watch for adverse effects such as nervousness, insomnia, tremor, fast heart rate, palpitations, and chest pain. Report any of these issues to the doctor right away. Adverse reactions include diarrhea, abdominal cramps, weight loss, increased appetite, the heart adverse reactions we just discussed, headache, tremor, insomnia, nervousness, fever, heat intolerance, and menstrual irregularities. Synthroid should be given on an empty stomach with a full glass of water and no other medications, food, or beverages. You should wait at least 20 minutes before eating, drinking anything other than water, or taking other medications. Remember, it should be taken with water, not coffee, soda, tea, etc. The medication should be taken exactly as prescribed at the same time of the day, preferably in the morning before breakfast. Don't use other drugs, over-the-counter products, or herbal remedies without first talking to the doctor or the pharmacist. Diabetes is caused by a disturbance in carbohydrate, protein, and fat metabolism, which increases glucose levels in the body. The medications used to treat diabetes assist in lowering the glucose levels in most cases. There are two types of diabetes, type 1 previously known as insulin-dependent diabetes mellitus, and type 2, previously known as non-insulin dependent diabetes mellitus. The person may be using insulin, oral diabetic medications, or a combination of both. The most important thing to remember when taking care of a diabetic person is to recognize the signs and symptoms of low or high blood sugar and respond quickly and appropriately. Remember, signs and symptoms of low blood sugar may include confusion, sweating, weakness, dizziness, headache, hunger, irritability, changes in speech, hearing, or vision. Be sure to have them immediately check their blood sugar using their glucose meter and record the result. The doctor should give you instructions of blood sugar levels to report and what to do. When the client has an order to monitor their blood sugar using fingerstick glucose monitoring. If you do not have parameters and instructions as to what to do, you should ask the doctor for this information. If the person is alert and able to swallow, give them something to eat that has a simple sugar, for instance, apple juice or glucose tablets. You would then follow it up with a complex carbohydrate and a protein, like a sandwich with meat or other protein, and a glass of milk. If you're unable to give them something to eat safely because they're unable to swallow, or if they become unconscious, call 911 immediately. The flip side is high blood sugar. Symptoms include frequent urination, sugar in the urine, excessive thirst, and when the levels are very high, the breath smells similar to juicy fruit gum. If you notice any of these symptoms, have the person check his blood sugar. If it's high, remember the doctor should have given you parameters. Contact the doctor for instruction. If they are unconscious, of course, call 911. Very low blood sugar and very high blood sugar are life-threatening. Through careful monitoring of blood sugar levels and following the prescribed treatments, these life-threatening circumstances may be avoided. Insulin is used to treat type 1 diabetes and type 2 diabetes when other glucose control methods have failed or are contraindicated. It is also used when the glucose level is elevated due to emotional or physical stress, or when oral medications are contraindicated because of pregnancy or hypersensitivity to oral medications. It is also used in hospitals to treat diabetic ketoacidosis, also known as DKA. It is especially important to avoid delays in the person's mealtimes to prevent low blood sugar if he or she is being treated with insulin. When you are caring for a person that is being treated with insulin, it is important to remember unlicensed direct care providers or MAPs may not prepare syringes, administer, or supervise the administration of insulin. Insulin relieves the symptoms but does not cure diabetes. Blood glucose monitoring is essential. Again, remember, you may be trained to do fingerstick blood glucose monitoring as long as it is not associated with an insulin dose. Don't skip meals. Accuracy at drug measurements is very important. The person or their family should not alter the order in which insulin types are mixed. The person should not change the brand of syringe or needle used without first talking to the prescriber. Know the signs and symptoms of low and high blood sugar and what to do. The person should wear or carry medical identification at all times. Oral diabetic medications stimulate the pancreas to release insulin in a person with a minimally functioning pancreas. They also provide several actions outside of the pancreas to decrease and control blood glucose. Oral diabetic medications can work in the liver to decrease the glucose production that occurs there. They can also increase the number of insulin receptors in the tissues, which provide more opportunity for the cells to bind sufficiently with insulin, which initiates the process of glucose metabolism. Remember, anti-diabetic drugs will relieve the signs and symptoms of diabetes, but they do not cure the disease. By following the prescribed therapeutic regimen, adhering to a specific diet, weight reduction, exercise, and personal hygiene programs, people can live long and healthy lives. Since cardiovascular problems can range from irregular heartbeats to high blood pressure, doctors use a wide range of drugs to treat them. This classification contains medications that help correct irregular heart rhythms, chest pain, and high blood pressure. To keep the cardiovascular system in the best shape possible, there are medications that help control cholesterol, strengthen the pumping action of the heart, and prevent potentially life-threatening clots. Many of these medications may have effects based on the person's response to them. Close monitoring and reporting of any concerns to the doctor, be they the person or yours, is essential. Antihypertensives are used to treat high blood pressure. All stages of high blood pressure are linked to an increased risk of cardiovascular and kidney disease. The goal of antihypertensive therapy is to reduce this risk. Medication is not the only answer. Lifestyle changes are a significant part of the treatment. These lifestyle changes may include weight loss, regular exercise, decreasing sodium in the diet, stop smoking, and moderation of alcohol consumption. The choice of which drugs to use is based on pre-existing conditions. For the therapy to succeed, the person must not only adhere to the drug therapy, but also make and maintain the needed lifestyle changes and follow-up appointments. Let's look at some of the drug groups that may be used to treat high blood pressure. Common drug groups used to treat high blood pressure include diuretics or water pills, ACE inhibitors, angiotensin receptor blockers, beta blockers, and calcium channel blockers. Arrhythmias, which are problems with the heart rhythm, cause significant illness and many deaths. The problem may be that the heart rate is too fast or it could be too slow. The problem may originate in the atria, the top of the heart, or the ventricle, the bottom of the heart. Problems in the upper part of the heart do not have as much effect on the heart's function or output as do issues in the lower part of the heart. Common medications used to treat arrhythmias include procainamide, quinidine, lidocaine, propafenone, propranolol, amiodarone, verapamil, and cardizem. If the person is taking antiarrhythmics, remember the person should take the medication exactly as prescribed. Take his pulse before the dose. If it is less than 60, call the doctor for instructions. Don't stop taking the medication without talking to the doctor. Keep follow-up appointments with the doctor. Report adverse events such as constipation, diarrhea, chest pain, ringing in the ears, unusually fast or slow heart rates, or rash. Nitrates are often used to help relieve acute chest pain. Nitrates cause veins to dilate by working directly on the vascular smooth muscle. The majority of dilation occurs in the veins, but they also work on the smooth muscles of the arteries. One of the most important things to remember is that if your client is taking Viagra, Cialis, or Levitra, they make sure the doctors and nurses are aware. If you give a nitrate in combination with one of these drugs, you run the risk of severe, life-threatening low blood pressure, which could result in death. If nitrates are taken with a calcium channel blocker, there is an increased risk of orthostatic hypotension. Orthostatic hypotension means your blood pressure drops when you change position, like when you get out of bed too fast and you feel like you're going to pass out. Common nitrates include amyl nitrate, also known as poppers. Remember, in combination with Viagra or other erectile dysfunction medications, this could be deadly. Isosorbide dinitrate, isosorbide mononitrate, and nitroglycerin. Oral anticoagulants are the drug of choice to prevent deep vein thrombosis, also known as DVT, which are clots in the deep veins, to treat people with problems with their heart valves, and to treat people with atrial fibrillation. Coumadin is a common anticoagulant you may see. It may be combined with an antiplatelet drug such as aspirin or Plavix. Antiplatelet drugs are often used to prevent venous and arterial clots that may travel to the heart, causing a heart attack, clots that go to the brain, causing a stroke, or clots that move to the lungs, causing a pulmonary embolism. It is very important to follow dietary restrictions, particularly not changing the amount of vitamin K, which is found in green leafy vegetables. When taking Coumadin, the person will need to have routine work completed to be sure he or she is getting the proper dosage. Remember, if the person is taking anticoagulant therapy, it is important to take it exactly as prescribed. Take Coumadin in the evening. Generally, it's ordered for 5 p.m. Watch for signs of bleeding, unexplained bruises, vomit that looks like coffee grounds, black tarry stools. Remove safety hazards to reduce the risk of injury. Be sure all lab work is completed. When taking Coumadin, don't increase green leafy vegetables or other foods and supplements with vitamin K. Other anticoagulants on the market do not require routine blood work, do not have restrictions for diet, and only target specific clotting factors. Xarelto and Eliquis are 2 examples. Remember, if the person you are caring for is taking an anticoagulant, watch for signs of bleeding, such as coffee ground emesis, black tarry stools, excessive bruising, and excessive bleeding gums. Another consideration is to be sure direct pressure is placed for at least 5 to 10 minutes on the puncture site when blood is drawn. If not, he or she may have a large bruise at the venipuncture site. Antilipemic drugs are used to lower abnormally high blood levels of lipids such as cholesterol, triglycerides, and phospholipids. The risk of developing coronary artery disease increases when serum lipid levels are elevated. In addition to drug therapy, diet, weight loss, and exercise and treating the underlying cause can reduce the lipid levels in the blood and decrease the risk of coronary artery disease. 3 common groups are the statins that lower lipid levels by interfering with the production of cholesterol by the body. With this group, watch for jaundice, yellowing of the skin, and the whites of the eyes. Zetia, which inhibits the absorption of cholesterol from the intestines, and niacin, which decreases triglycerides and increases HDL, which is good cholesterol levels. Birth control pills are synthetic hormones that mimic the way real estrogen and progestin work in a woman's body. The pill prevents ovulation. No new eggs are released by a woman on the pill since her body is tricked into believing she is already pregnant. Research has shown women who take the pill for at least 1 year are 40% less likely to develop uterine and ovarian cancers. Other important benefits of birth control pills include regulating irregular periods, controlling acne, reducing menstrual cramps, and relieving the symptoms of premenstrual syndrome. The hormones contained in oral contraceptives also provide a protective effect against pelvic inflammatory disease. Important things to remember about birth control pills include cigarette smoking increases the risk of serious cardiovascular side effects from oral contraceptive use. Oral contraceptives should not be taken in women who currently have the following conditions: clotting problems or a history of deep vein thrombosis, DVT, cerebral vascular or coronary artery disease, current or a history of, valvular heart disease with complications, severe high blood pressure, diabetes with vascular involvement, headaches with focal neurologic symptoms, major surgery with prolonged immobilization, known or suspected breast cancer, uterine cancer or other known or suspected estrogen-dependent cancers, undiagnosed abnormal genital bleeding, certain liver problems, liver cancer, known or suspected pregnancy, or hypersensitivity to any component of the product. There are certain medications and herbal remedies that may decrease the effectiveness of oral contraceptives. They include antibiotics, anticonvulsants, and other drugs that increase the metabolism of contraceptive steroids. Rifampin, barbiturates, phenylbutazone, phenytoin, carbamazepine, felbamate, oxycarbazepine, topiramate, grizifulvin, and bocetin, ampicillin, tetracycline, St. John's wort. There are several medications used to treat erectile dysfunction resulting from decreased blood flow through the corpus cavernosum. Generally, this type of erectile dysfunction is a result of vascular or neurologic conditions. There are two forms, an injected medication, alprazolam, and the form that is taken by mouth, Viagra, Cialis, and Levitra. Viagra is also indicated for the treatment of pulmonary arterial hypertension. Erectile dysfunction drugs may interact with other drugs in the following ways. Nitrates, such as nitroglycerin and isosorbide, and alpha blockers, such as Flomax, Cardura, and Minipress, when used in combination with ED drugs, may cause severe low blood pressure that could lead to a serious cardiac event, including death. Ketoconazole and itraconazole and erythromycin may result in increased levels of Cialis and Levitra. Protease inhibitors such as Indivir and ritonavir may result in increased levels of Cialis and Levitra. Adverse reactions. Patients with known cardiovascular disease have an increased risk of cardiovascular events, including heart attack, sudden cardiac death, ventricular arrhythmias, bleeding in the brain, transient ischemic attacks, which is a mini stroke, and high blood pressure. Dizziness, headache, flushing, upset stomach, vision changes, and priapism, which is an erection lasting more than 4 hours, which can lead to irreversible damage to the erectile tissue. Generally, the treatment for most gastrointestinal disorders is conservative, symptomatic, and supportive, working on dietary habits, diet, rest, and stress management will often relieve most GI symptoms. If these measures are not effective, it may require drug therapy and possibly surgery. The medications we will be looking at are used to treat heartburn, reflux, and other common stomach ailments. H2 receptor antagonists are usually prescribed to treat peptic ulcer disease. They include Zantac, Tagamet, and Pepcid. Many of these drugs are now available over the counter, and people will use them to treat or prevent heartburn or problems that may be solved by eating less, drinking some milk, or eating some crackers. This group of medication works by decreasing the amount of acid that is secreted into the stomach. It is very important to remind the person to take as prescribed or recommended by the doctor. Take with a food or snack if desired. If the medication is prescribed as once daily, take at bedtime for the best result. Don't take antacids within an hour. Don't take more than 8 weeks unless ordered to do so by the doctor. Immediately report black tarry stools or vomit that looks like coffee grounds, diarrhea, confusion, or rash. Don't take with other drugs, over-the-counter medicines, or herbal remedies without consulting your prescriber. Protonics, Prilosec, and Nexium are proton pump inhibitors. They decrease acid production in the stomach. They are unstable in an acid environment. Therefore, they should not be crushed or given by the enteral route. The enteric coating or capsule will dissolve when they reach the small intestine, where they are absorbed rapidly. Be sure to remind the person to take the medication before eating. Swallow capsules or tablets whole. Do not chew, crush, or break the tablet or capsule. Observe for the drug's effect if symptoms persist or adverse reactions such as headache, diarrhea, abdominal pain, or nausea and vomiting occur. Notify the prescriber. Don't take over-the-counter preparations or herbal remedies without consulting the prescriber. When infection attacks the body, Anti-infective medications can help rid the body of the invading organism. There are 4 types of anti-infective drugs: antibiotics, antiviral, antitubercular, and antifungal. To select an appropriate anti-infective, several things must be considered. First, the microorganism must be isolated and identified. Then it must be determined which drugs are effective in treating it. This may take as long as 48 hours, so doctors will often send the specimen to the lab and then treat it with a medication that usually will take care of the symptoms he sees. This is the reason that the doctor may change an antibiotic after the test results are back. Another consideration has to do with the location of the infection. For the drug to be effective, an adequate concentration of the medication must be delivered to the infection site. The last consideration deals with the cost of the drug, as well as its potential adverse reactions and the possibility of patient allergies. When taking anti-infective, it is important to remember, take the medication exactly as prescribed. Take all of the medication even if you're feeling better, unless directed to do otherwise by the doctor. Some anti-infectives may decrease the effectiveness of oral contraceptives. Be sure to read your medication information resource. Report unusual reactions such as rash, fever, or chills. Don't take leftover drugs from previous illness or take someone else's medication. Store appropriately. Some may require refrigeration or protection from light.